Behavior change theories are useful tools for organizing how you approach your client's program and build their intrinsic motivation. By familiarizing yourself with different behavior change theories and their frameworks, you can target strategies that are specific to your client. By carefully selecting your strategies, you can move your client from being extrinsically motivated to being intrinsically motivated. This can lay the groundwork for your client to participate in lifelong physical activity. In this video, you will learn about behavior change theories and frameworks, and how you can implement strategies to increase your client's intrinsic motivation. First, some questions to consider. Have you ever been unsuccessful in changing behavior? Do you think changing a behavior is easy or hard? How do you manage someone who has decided to make a change? Where do you start? What do you do or say to someone who doesn't seem motivated at all? Has pushing the truth worked in the past? After watching this video, you will be able to describe what a behavior change framework is and how you can integrate it into your practice. Behavior change is hard. Just ask any physician treating patients with high blood pressure. To increase your client's chances of success, it's important to know the different behavior change theories and how to use them to enhance your client's intrinsic motivation. We will discuss what behavior change theories and frameworks are. Next, we will talk about relationships between motivational strategies and theoretical frameworks. Behavior change theories aren't just boring things you need to memorize to do well in the exam. They are evidence-based ways to organize information and target problems. By selecting a set of behavior change models that speak to you, you can create a plan for how you will motivate your client to exercise that doesn't rely on loud music or yelling. In this video, I will use the trans-theoretical model in relation to exercise as an example of how to put the theory into practice. The trans-theoretical model postulates that individuals vary in their readiness to change behavior. Potential new or existing clients will fall into any of the 5 stages of change. The first stage is pre-contemplation. You will likely not encounter potential clients coming to you who are in pre-contemplation, as individuals in this stage are not considering starting a new exercise routine. The second stage is contemplation. Potential clients who reach out to you to get more information, but who don't make appointments, may be in contemplation. These individuals are considering starting a new exercise routine in the next 6 months. The third stage is preparation. Most new clients you interact with will be in preparation. These individuals want to begin a new exercise routine within the next 30 days. They are hoping that you have the skills to move them on to the fourth stage, which is action. Once a new client begins their first session, they are in action because they're actively exercising. After 6 months in action, a client moves to the 5th stage, maintenance. They have been engaged in an exercise with you that you've created. Relapses are almost always inevitable and become a part of the process in working towards a lifelong change. For potential clients who are in pre-contemplation, contemplation, and preparation, you can use the cognitive strategies from Table 7.1 in the textbook. These stages are tricky to move through because these individuals have not yet made a behavior change, and change is hard. We will review these cognitive strategies next, along with motivational interviewing. For clients who are in action and maintenance, you can use the behavioral strategies from the same table. These stages are less challenging to move through since the client has already made a change. We will review those later. Motivational interviewing is a critical part of moving your client through the trans-theoretical model. Along the way, you will have to keep things centered on how your client feels and where they are in the cycle. An easy acronym to remember is RULE. Resist the writing reflex, understand the client's own motivations, listen with empathy, and empower the client. These 4 things will keep the interview positive and goal-oriented. You can use motivational interviewing at all stages, but it is particularly useful in the potential client who is in pre-contemplation, contemplation, or preparation. Now we will discuss how to use and implement cognitive strategies. Here, we will review 2 strategies. The first is consciousness raising, which involves raising awareness about healthy behaviors. For example, you ask your client what they currently know about sedentary behavior. The second is dramatic relief, which involves eliciting an emotional response from the client followed by introduction to positive solutions to capitalize on the emotional response. For example, you could question your potential overweight client about their ability to interact with their grandkids. If they become sad about their condition, you can provide them with information about how exercise can improve their quality of life. To learn more about motivational interviewing, refer to Chapter 7 in the textbook or the resources posted to Canvas. Now we will discuss behavioral strategies you can use on your client who is in action or maintenance. These strategies will move your client from being extrinsically motivated or motivated by outside factors such as weight loss to being intrinsically motivated or being motivated by intrinsic factors such as satisfaction. These strategies will also assist with adherence to exercise. Here we will discuss two strategies. The first is self-liberation, which involves your client's commitment to change and a belief in their ability to change. For example, in the new client interview, you can help your client set SMART goals. The second is stimulus control, which involves removing triggers for unhealthy behavior or adding stimuli for healthy behavior. For example, your client can prepare their workout bag the night before and leave it by the door to simplify exercise. We have discussed the trans-theoretical model of change to help you understand the concept of a theoretical framework and how it is used. But there are so many frameworks to choose from. They include the health belief model, the theory of planned behavior, and more. Refer to Table 7.3 in the textbook to learn more about the pros and cons of each. To review, a framework is a useful way to organize and tailor your approach to changing your client or potential client's behavior. It will dictate which strategies you select to help your clients change or maintain behavior. The trans-theoretical model is one such framework, but you should subscribe to the one that most speaks to your belief system by reviewing all the frameworks described in Chapter 7. Motivational interviewing is a useful technique to facilitate behavior change and can be applied in different frameworks. To learn more about behavior change theories and strategies, review Chapter 7 in ACSM's Resource for the Personal Trainer, 5th edition, and the resources in Canvas.